During this webinar, we will discuss what air toxics are and their impacts, in addition to the considerations for the air toxics regulations rule. The MPCA is creating new air toxics regulations that will go beyond the current state and federal standards. We are currently in a draft stage, and everything we share is still conceptual. Eventually, the new rules applying to the industrial facilities within the 7-county metro area will establish clear, enforceable standards, requiring facilities to monitor, report, and comply with stricter pollution requirements to improve air quality. This will further our mission of protecting and improving Minnesota's environment and our health standards. Before we get further into the presentation, we wanted to acknowledge the tribal state relations in the statement. The state of Minnesota is home to 11 federally recognized Indian tribes with elected tribal government officials. The state of Minnesota acknowledges and supports the unique political status of tribal nations across Minnesota and their absolute right to existence, self-governance, and self-determination. This unique relationship with federally recognized Indian tribes is cemented by the Constitution of the United States, treaties, statutes, case law, and agreements. The state of Minnesota and tribal governments across Minnesota significantly benefit from working together, learning from one another, and partnering where possible. The Minnesota Department of Health and the Minnesota Pollution Control Agency recognize, value, and celebrate the vibrant and unique relationships between the 11 tribal nations in the state of Minnesota. Partnerships formed through government-to-government relationships with these tribes will effectively address health disparities and lead to better health outcomes for all of Minnesota. We are pleased to have the opportunity to engage with Minnesota's tribal nations for the air toxics rulemaking effort. Today, during the presentation, we will share the importance of the rule by reviewing what air toxics are, how they affect our daily lives, and the potential health implications. We will then have breakout rooms for discussion before we talk about the rule itself and considerations for environmental justice area community members. We will end the webinar with a large group discussion for people to share their thoughts and ask more questions. As we look forward to the breakout rooms, here are some questions that we'll be posing. You can think of these during the first portion of the presentation to get prepared for the breakout rooms and look for information that may catch your eye. Do you have any general questions is the first one that we want to ask. Is there anything that you need further clarity on? Have you heard or thought about air toxics in your neighborhood before this rulemaking? Are there any air toxics that you think are a concern in your neighborhood? Are there any facilities in your neighborhood that are of concern to you? What additional resources would be helpful for you to understand the impacts of air toxics and how they affect your human health? And then, should facilities in EJ areas be regulated differently than non-EJ areas? While we can't promise what you share will be seen written directly in the rule, since we lean on the expertise within the MPCA and people from around the 7-county metro area, the information and stories you share during the discussions may help us make more informed decisions on the regulation. So we appreciate your presence and insight greatly. As a reminder, you can post something in the chat throughout the webinar for us to respond to at the end of the webinar. There will be a survey available for 30 days after the meeting to provide smart comments as well. This is the clearest way to leave feedback and allows others to see your questions and comments. Last, we want to be clear there will be other opportunities for informal input in the rulemaking process. You can always reach out to Cassandra or I for questions. Thank you all for being here. And with that, I'll hand it off to Brenda to begin discussing what air toxics are.
Great. Thank you, Bennett. Hello, everyone. My name is Brenda Vaness, and I'm on the technical team that is working on the rulemaking effort for air toxics. So in the next couple of slides, I'm going to go over what authority we currently have to regulate air pollution. And then I'm also going to go over some terms that you might hear throughout, or go over definitions of terms that you might hear throughout the presentation. So MPCA has authority to regulate some air pollutants through the Clean Air Act of 1970, as well as some amendments made to that act in 1990. Primarily, the focus of the Clean Air Act is on criteria pollutants and hazardous air pollutants. Criteria pollutants are commonly, or 6 commonly found air pollutants that have ambient air standards. And these are national standards for ambient air that are reviewed periodically, and it's required by the Clean Air Act. Those 6 pollutants include carbon monoxide, lead, nitrogen dioxide, ozone, particulates, which consist of particulate matter 10 or PM10 and PM2.5. And it also includes sulfur dioxide. The Clean Air Act also covers hazardous air pollutants, or HAPs, and there is 188 air toxics defined in the Clean Air Act. All 188 HAPs are considered air toxics, but there are many more air toxics than just those 188 HAPs. And currently, there are not national standards for air toxics that aren't included on that list of 188 HAPs. Air toxics are pollutants that are known or suspected to cause cancer or other serious health effects or adverse environmental effects. And you'll notice lead is asterisked under the criteria pollutants. That's because lead is, in addition to being considered a criteria pollutant, lead is also a HAP. Next slide, please. So because there are a number of air toxics that don't have national standards, MPCA is going through the rulemaking process for air toxics. Rulemaking is the process used by government agencies to create, modify, or repeal rules and regulations. These rules and regulations are a form of administrative law that governs the conduct of individuals, businesses, and other entities within the jurisdiction of the relevant government agency. Also throughout the presentation, especially when Jesse from MDH talks, you might hear the term inhalation health benchmark. This is also known as an air guidance value. These are concentrations of a chemical that is likely to pose little or no risk to human health. These values are used in analyses to determine human health risks from exposures to chemicals in the air or pollutants in the air. Next slide, Bennett. So a little bit more context on air toxics and what they are. Air toxics can include metals, dioxins or furans, benzene, which is a volatile organic carbon, PFAS, which are known as forever chemicals, and quite a few others that the list is too extensive for us to list here on one screen. Some sources of air toxics can include combustion. Combustion includes the combustion of fuel for energy in boilers, so boilers in industrial facilities, hospitals, schools, large facilities along those lines. And then combustion also covers combustion of fuel in vehicles for transportation. Other sources of air toxics include wildfires, recreational fires, manufacturing, chemical use and storage, and other industrial processes. That includes mines, grain mills, foundries, along with other industry types. And the asterisk sources in this list indicate the sources that will not be covered by this rulemaking. Some impacts of air toxics can include cancer. While not all air toxics cause cancer, it's dependent on the toxin. Cancer is one effect of air toxics, along with respiratory issues, cardiovascular issues, and other health effects. Next slide, Bennett. So a little bit more information on the Clean Air Act. It was established or enacted in 1970. And it provides authority on the federal level to allow states to regulate air pollution. So as I mentioned before, it focuses largely on the 6 criteria air pollutants that we have National Ambient Air Quality Standards for, NAAQS. And then it also provides us authority to establish standards for hazardous air pollutants, or NESHAPs. The amendment in 1990, it established the originally included 189 chemicals as hazardous or air pollutants. or HAPs, and it provided authority to regulate them. It also directed EPA to adopt air toxic control standards, which required EPA to identify industrial sources that are emitting HAPs. It also required EPA to identify maximum achievable control technology, or MACT, and this is control equipment that is able to best control air toxics. And then it also required EPA to conduct risk assessments of the standards and determine if those standards were protective. So today, as mentioned before, there are currently 188 HAPs that are covered by the Clean Air Act. And with that, I will hand it over to Jesse.
Hey everyone. Um, Really grateful to be here this evening with you all. My name is Jessie Carr, and I'm an epidemiologist at the Minnesota Department of Health. And my colleague Curtis and I are going to talk a little bit about how we support this really exciting work going on at MPCA. So, as an epidemiologist, we think about like who, what, when, and how we're all exposed to chemicals out in the environment. And Curtis is a toxicologist, thinks about, really what chemicals do inside the body. So together, it's that's part of the way that we support and work with the Pollution Control Agency to understand what's in the air and what it could be doing to our communities and bodies, and identify strategies to protect health. So moving into the next slide, you know, um, you've heard just a little bit from Brenda about how air pollutants impact the body. And not normally, but you hear most about fine particles and ozone that are in that regulated by the Clean Air Act, and often are part of the air quality alerts that we hear. And these are some of you may be familiar with some of the common ways that these types of pollutions impact health. If you could advance the animation. We're fancy. We're really excited about this regulation, and concerned about air toxics because they can negatively impact a really wide range of body systems, from our reproductive systems, our immune system, as mentioned, some types of cancer, as well as neurological and developmental impacts. And so this additional information and regulations will help us really target those toxins with known health impacts. Some of the ways that we work together, in addition to how air pollutants impact our bodies, the data tell us some about how and the ways in which they impact communities. As part of our work together, we've looked over the years at the ways in which air pollution is responsible to the overall health burden in our communities. So, as one example, we looked a few years back at the impacts of fine particles, of which air toxics are a part, right? So, we know we talk a lot about particles, but we know that air toxics are in there in that mix. Um, what we found was that even though we saw improvements in the air quality in the Twin Cities metro, we know that even those low to moderate levels of air pollution can adversely impact health, especially and even more for people who already have lung and heart conditions. What this map on the right shows is a map of the 7-county Twin Cities metro area. And that shows by the zip codes, it shows the share of deaths that were attributable or caused, at least in part, by particulate air pollution. And so, even though we're meeting these standards for the most part, we are still having um, a large contribution, a large burden of health impacts, and they, as you can see, are really not evenly distributed across communities. The highest estimated rates of air pollution related death and disease are found in neighborhoods with the largest percentage of Black, Indigenous, and people of color, lower income residents, uninsured residents, and people who live with disabilities. And so that's one of the reasons why this regulation is so important to further address those health inequities that we're seeing. Next slide, please. So in the Minnesota Department of Health and in the way that we work together with pollution control, um, we know that all Minnesotans are susceptible to health impacts of air pollution. But as you saw on that last slide, they do not affect all Minnesotans equally. So when we're coming in support of pollution control, acknowledging the structural inequities formed through institutional systems like city planning, infrastructure, and policies that have led to some of those disparities in local source pollution, as well as underlying health disparities. People living near high traffic roads and heavy industry often have more exposure to air pollution than those who live, work, gather in less polluted areas. And that unequal burden of air pollution, together with higher underlying rates of lung, heart, and other health conditions, um, that's part of it's those combinations that lead us to have disparate health outcomes across our communities. And with that frame, I'll turn it over to Curtis to talk more about the toxicology perspective.
Thanks, Jesse. As mentioned, my name is Curtis Hedman, and I am an air toxicologist with the Site Assessment and Consultation Unit of the Minnesota Department of Health. My colleague Jesse just provided an overview of how the MDH Environmental Epidemiology Unit studies air pollutants and their potential health effects on a large population scale. MDH's Site Assessment and Consultation Unit studies air toxics health considerations on the impacted neighborhood level and down to the exposed individual. We do this largely by evaluating and developing air guidance values for air toxics that are used by MPCA risk assessors, by providing technical support for human health risk assessment activities, and by participating in cross-agency efforts such as this air toxics rulemaking effort. Next slide. Air pollutants, including both the criteria pollutants and air toxics, can come from many different sources. This includes natural sources such as wind-suspended soil dust and wildfires, area sources like agriculture and cities, stationary sources like industrial facilities and power plants, and different types of mobile transportation sources. For this rulemaking effort, we were focused upon the stationary sources of air pollution. Next slide. And it's when these stationary sources emit pollutants into the environment at concentrations above inhalation health benchmarks that action should be taken to lower these emissions. This point relates to a couple of the upcoming breakout room session questions. Are you concerned about any air toxics in your neighborhood? And next slide, are there any facilities in your neighborhood that you're concerned about? Next slide. Looking at our unit's role in a bit more detail, MDH's air toxicology program evaluates, develops, and recommends air guidance values to be used in Minnesota. We ensure that the air guidance values used are protective for all populations, including sensitive individuals such as infants, pregnant women, and the elderly, and that they are also protective for all available exposure durations. As a result, breathing in a chemical at levels above an air guidance value doesn't mean a health effect will definitely occur. It does mean, however, that the risk for an associated health effect is increased. The greater the concentration is above the air guidance value, the greater this risk becomes. Next slide. We'd like you to consider the upcoming breakout session, what additional resources might be helpful to better understand how air toxics affect human health. We appreciate any feedback you have that will help us to better serve you. Next, what this means for you, MDH's Environmental Health Division works closely with MPCA partners to evaluate, mitigate, and prevent exposures. The air guidance values, or inhalation health benchmarks, they're based on best available data and professional judgment to be protective of human health. And when these air guidance values are exceeded, MDH seeks to engage with communities and other partners to find ways to lower exposure levels as quickly as possible. Jesse and I would appreciate being able to answer any questions that we presented to you this evening, and our contact info is listed below if any of you would like to reach out for comments or questions.
All right, so I think we're almost all back, so we'll get started again. My name is Anna Cinco. I'm an air toxic risk assessor at MPCA. I am just taking over for Cassandra Meyer, who is having some technical difficulty. Oh, and now she's here. So Cassandra, go ahead.
Oh, thank you for your patience. My computer was struggling. All right. Hello, everyone. I'm Cassandra Meyer. I'm an engineer in the Air Policy Unit at the Minnesota Pollution Control Agency and the technical project lead for this rulemaking. I'll touch on why we're working on this now and then get into some high-level details of what we were directed to do and what we are considering for these rules. So as Brenda touched on earlier, we at the state level, the MPCA implements federal air toxics regulations. And it's important to know that these are the minimum that regulated facilities must meet. The Clean Air Act does not limit the state's authority to regulate air pollution, and states can have more stringent or more environmentally protective laws and requirements. There are also geographic and economic differences in every state, and states will look at local needs to create more rules. And therefore, that is what the Minnesota State Legislature did. They found that there was a need in Minnesota to have state air toxics rules. And so we at MPCA were directed by the legislature to do this rulemaking. This is the first rulemaking of its kind for Minnesota, where we are directed to regulate a breadth of air toxics. MPCA has had voluntary efforts around air toxics that worked towards reducing pollution, but again, those have only been voluntary, and those are actions that a facility would choose to take, but would not necessarily be required to take. And since federal regulations do not necessarily cover every pollutant, just those 188 hazardous air pollutants, these rules at the state level will hopefully improve air quality in the metro, which is where these rules will apply, and I will touch on that next. But again, the most simple answer to this question of why are we doing this now is that we were directed by the legislature. Next slide, please. This slide provides an overview of some of the details in the statute. And as mentioned earlier, during our 2023 state legislative session, the state legislature, our government, required that the MPCA as a state agency required our commissioner to adopt rules to, quote, implement and govern regulation of facilities that emit air toxics. They did that through a statute, which laid out both restrictions and specific things that we need to address at a minimum. The restrictions laid out for us include those on the left side of the slide here. We are on a 3-year timeline. We have to get our draft rules on what's called Notice of Intent to Adopt by May 18th, 2026. And we're still in the developing stages, still working on what those rules could potentially look like, which is why we're here today. The rules will only be applicable in the 7 counties of the metro area. They are not limited to only environmental justice areas, but they will apply everywhere within those 7 counties that are listed on the slide. They will not apply to facilities with what are called registration option B permits. And these are types of this is a type of air permit for sources that purchase or use less than 2,000 gallons of VOC containing materials on a calendar year basis. in the metro area, these are mostly auto body repair shops. Then on the right side of the slide, these are things that the MPCA was directed in the statute to address at a minimum. So this sets the floor for our efforts and not the ceiling. So we are directed to address specific air toxics, types of facilities, performance tests, monitoring of emissions, reporting requirements, record keeping, inspection frequencies, and these requirements that we develop and address, they must reflect risks to human health and the environment, a facility's compliance record, and exposure of residents of environmental justice areas. And previously, during informal comment periods, we have asked for specific input on how we should accomplish this and having our rules reflecting exposure of residents of environmental justice areas. And again, we are bringing that back as we would like to continue receiving input on this. Because again, these rules apply to all areas within the 7-county metro area, not just environmental justice areas. So we would appreciate your thoughts on how to work out this nuance. Next slide. We also have another rulemaking effort happening at the same time as this rulemaking, and it's on the same timeline as air toxics regulations. So we wanted to highlight some of the differences and some of the overlap of this air toxics regulations rule and the cumulative impacts rulemaking. So this includes where the rules apply, who the rules apply to, and when, if it was defined in the statute. In terms of where the rules apply, they both apply in those 7-county metro areas. Only cumulative impacts applies in Duluth and Rochester. However, cumulative impacts applies only in demographically defined environmental justice areas, where, at least in the 7-county metro areas, air toxics regulations applies to all areas within the counties. Cumulative impacts could also apply within federally defined Indian country. There are also some differences in who each of these rules apply to. That is based on the type of air permit that a facility may hold. The different types of air permits are listed here in that green row. And air toxics regulations rules will broadly cover and apply to all types of air permits, except that one that was exempted by statute. Cumulative impacts, on the other hand, will only apply to individual permit holders. And just very basically, individual permits are the type of air permits that have site-specific requirements. And lastly, both rules are on the same timeline to have our draft rules on notice of intent to adopt. But the air toxics regulations statute requires that we amend existing air quality permits as necessary within 3 years after adopting the rules, where cumulative impacts doesn't have that requirement. So those are some of the differences in the overlap between the two major rulemakings that are happening at this time. Next slide, thank you. So I'll provide a high-level conceptual overview of the air toxics regulations rules and what we're thinking so far. And also I want to caveat that with all of this information is conceptual. Even some of the terminology that we're using, that is preliminary and could be limited to just this rulemaking effort. We'd love your feedback on the concepts and what we're exploring, hear what other ideas you have. We don't have any proposed rule language to respond to yet. We're still working that out. And no final decisions have been made. So it is all draft and conceptual still. Next slide. All right, I'll walk us through the draft rules structure flowchart here. And first, before I do that, I want to acknowledge that these rules for air toxics regulations, this area can get really specific and really technical very quickly. So it might not be accessible if you're not already familiar with this type of work. And there are also many people at the agency who are willing to talk with you and have conversations about what this is and try and help break it down however that could be for you so that it's more helpful. So if you're interested in providing feedback, but you feel like you need more information in order to feel prepared to do that, please reach out to us and we'll see what we can do. And Bennett would be your first point of contact if you're interested in something like that. So this is our conceptual framework for the rules. It is generally how we're looking to structure the rules in Minnesota, potentially. It is similar to rules from other states. It does not include all the details, like where there may be exemptions, in addition to the one outlined in the statute. And then there are some key terms here as well. So I'll walk us through the steps here. And the top left, this is the first step. It is a screening analysis. Facilities or regulated parties, they would calculate their actual air toxics emissions. They'd gather stack data, and then they would do a screening analysis. And they do that by comparing that information to screening thresholds. So if that information shows that their emissions are below the screening thresholds, no further action is needed. If the air toxics are above thresholds, there are two options, and that moves us down to stage 2. Facilities could make operational changes and or take permit limits to get and stay below screening thresholds. These actions could possibly be done using potential and what would be a new document called a Compliance Determination Protocol, or CDP. Or a facility could model to show risks, and this is called an ERA, or Air Emissions Risk Analysis. So this second analysis is a risk analysis. This could be required for or chosen by a facility. So they might decide we don't want to do anything that affects our actual emissions. We're going to decide to move on to the risk analysis. And if a facility does a risk analysis, it's more involved and more detailed. They use what's called their potential emissions, and that is what is allowed in their permit. This is opposed to their actual emissions that would be used in the screening analysis. They then compare their modeled emissions, the potential emissions, to risk levels. If those emissions are below risk levels, no further action is needed. If they are above risk levels, they would potentially need to make operational changes and or take permit limits and or develop an air toxics reduction plan. This reduction plan would also possibly be a new document. And that would include what actions they need to take and the timeline that they have to take those actions to show that their permitted emissions are below risk levels. So a quick recap, flowchart is the broad overview of the rule structure that we're considering. The first stage is a screening analysis that uses actual air toxics emissions. The second stage is a risk analysis using potential or permitted allowable emissions. And then the third stage involves any changes that need to be made to show that those permitted allowable emissions are below risk levels. Next slide. One of the items that we are specifically seeking feedback on in developing these rules concerns this bolded language at the bottom here. This whole slide is language from the statute that directed this rulemaking. So we have a global statement at the top that says, in developing the rules, the commissioner must establish testing, monitoring, reporting, record keeping, and inspection requirements for facilities that reflect. And then we've got the 3 items there. The first 2 are around risks to human health and the environment and facilities record of compliance. But then we have this third item that was bolded by us and it says, and any exposure of residents of an environmental justice area to the facility's air toxics emissions. And so I'll read those book-ended statements together because we would really like your feedback on how to accomplish this. So in developing the rules, the commissioner must establish testing, monitoring, reporting, record keeping, and inspection requirements for facilities that reflect any exposure of residents of an environmental justice area to the facility's air toxics emissions. We'll have a question related to this as part of this comment page. And again, we'd really appreciate any ideas you have on what this could look like. And again, another reminder that all of these ideas that we've discussed and we will continue to discuss, they are draft and conceptual. These are all things that we're just exploring at this time, and we're looking for feedback and ideas from you all. But aren't necessarily, even if we ask questions about them, we aren't necessarily going to be including all of it in the rules as we're still working out all the details. And I'll pass it over to Bennett to talk us through the questions that we'll have posted on our Smart Comment page.
Awesome. Thank you, Cassandra. And then thank you, Anna, for sticking in for the couple seconds that you were there for. We appreciate it a lot. So I'm going to read through some of the questions that we have for stakeholders. These questions will be available for 30 days on our website, and they will be live after this presentation. We really would appreciate your feedback on these. It's very useful for us to read through it and then consider the answers when we are working through the concepts. So according to the statute, the rules must reflect any exposure of residents of an environmental justice area to facilities' air toxic emissions. How do you recommend accomplishing this? Should facilities be required to inform surrounding residents if they need to make operational changes to reduce the risk from the air toxic emissions? If so, what information would be helpful to receive? Should facilities be required to public notice their changes to provide opportunity for input and/or hold a public meeting in addition to informing residents? If so, what information would be helpful to have as a part of these notices and meetings? If facilities are required to public notice any changes made and/or hold a public meeting, at what point in the process should the facility notice or meeting occur? One above screening thresholds, when making changes to the facility, when a risk assessment is completed, when a risk reduction plan is required, or any other time. If a facility were to public notice or hold public meetings, how would you like to receive that information? Via mail flyers, email, MPCA website announcement, via news and newspapers, or other options? And I also will add that this is just informative for us to know as we've been doing more community engagement outreach. Some more questions are, should petitions be allowed? And if so, what action should be allowed to be petitioned for? And please share any example that you may have. Anyone can petition for the screening values to be updated. Anyone can petition for a facility to redo or update their screening analysis, or any other option. If petitions were allowed, what evidence should be required with the petition? This could include information about emissions, pollutants, health effects, calculation methods, stack test results, etc. Are there other aspects of the rule that you would like the MPCA to consider? Are there other rules or regulations from other states that the MPCA should consider in writing these rules? Are there air toxics or facilities of concern in your neighborhood? If there's a facility of concern, what do you feel is the best resolution for your concern? For example, reduce allowable emissions, limit operating hours, add more control equipment, have the facility get public input about changes it could make, etc. Should the facility in environmental justice areas be regulated differently than non-EJ areas? If so, how should the regulations differ? Should it be faster compliance with the rule, public notice in EJ areas and not in non-environmental justice areas? have to rescreen in these areas, or anything else you can think of? What is your perception of the MPCA and how we're doing? What organizations, industry groups, etc., should we notify when this rule is on notice? And please provide their contact information if you're comfortable with doing that. All these will help us through our engagement, outreach, and rulemaking process. And we thank you for any comment that you leave with us. And for future engagement, you can reach out to me at any time. We're very interested in hearing how you want to be engaged and if there's any other avenues to go through. We've heard people tell us that we should go through the radio, through newspaper, contact certain groups and certain people. We want to hear about everything that you can think of. And last, are there any other updates or additional presentations? And I do want to reference that this presentation was brought about by other community members with the desire to see us have more introductory content and material so people can access it. And again, we have other avenues for you to leave comments on the rulemaking. This is the link and a QR code to the smart comment that we'll have open until July 25th, 2025. And I'll let this be on the screen for a couple seconds so you can scan it. And last, if you want to stay connected, please sign up for our email list. It's informative to hear about future meetings that we're going to have, future webinars, and then you could also hear about other rulemaking processes that are going on. We want to keep you in the loop for what's happening with air toxics regulations and what's happening in the MPCA. And you could also just look up air toxics regulations on Google, and then it'll bring you to them. Air toxics regulations, Minnesota Pollution Control Agency, and it'll bring you to the webpage as well. And we have a link at the bottom. And with that, I want to open up to questions and answers. I know in my breakout group, we had some really great contributions from some of the guests, and I want to open it up to everybody if you have any questions, comments, or things you want to discuss. And thank you, Ian, for putting that in the chat.
Yeah, sorry for coming in late. I had a prior meeting engagement. But yeah, the district council's in getting a pulse of what that particular community sees as needing oversight or may have concerns with would be, I think, a good approach to getting into the districts or getting in the word out on the street.
Awesome. We appreciate it a lot. I'll give it 1 or 2 more minutes, and then I'll post our contact information as well. All right. With that, I appreciate everybody for coming by and joining us. If you want to reach out and ask any more questions, Cassandra is a project lead, has a wide range of knowledge on the rule. Same with Brenda. And I am Ben Lupo. I'm doing community engagement outreach. And it'll be my pleasure to be able to talk to you more. And then Hannah is managing media. Thank you.